Yeah, good to go.
Thank you, Mr. Samuel. We think we can go to the first page. We go to the next page. Yes, today we are going to look at the theoretical basis of nutrition counseling. And this course is wide, and it is covering for nutrition students, public health students, and including healthcare management. It is not something that is very complicated, and I believe each one of you has heard of nutrition counseling before, and many of you have had experience conducting nutrition and health counseling and education. So today we would just like to go deeper into what nutrition counseling is and how it is conducted. Nutrition counseling is basically a type of health assessment that only focuses on diet and exercise. We have different types of counseling, but here we want to focus on the part that talks about nutrition. How do you talk to someone about making healthy food choices and forming healthy eating habits? So we find that this kind of nutrition counseling is usually very important when it comes to people with eating disorders, such as anorexia nervosa, bulimia nervosa, and binge eating. The goal of nutrition counseling is to help individuals set achievable health goals and also maintain them for a lifetime. You do not want to counsel someone for about 6 months, and after 1 year you find that the person is back to square zero. No. This is part of behavioral change. When you counsel a person, you have to tell them still to make sure that they change their behavior patterns so that they can adapt a healthy eating choice and form healthy eating habits. We go to the next. So this process of nutrition counseling involves a registered dietitian or a nutritionist that is working with various individuals. One, you have to make sure you assess for usual dietary intake. Ask this person, how do you feed every day? What are the different kinds of food that are on your menu each day? What do you eat for breakfast? What do you eat for lunch? What do you eat in the evening for supper or for dinner? When the person tells you this, then you are able to identify areas that need change according to their narration, how they have told you how they feed. Maybe someone tells you that, I wake up in the morning, I make tea, I eat with the bread, I eat about 6 slices of bread, that is around 7 a.m. At around 10, I fry eggs, about 4 eggs, and I again eat them with bread and milk tea. Then at 1 p.m., I eat a cedar bafra with maybe different kinds of sauces they will mention to you. The person tells you again at around 3 p.m., I go ahead again and take tea with the bread again. Then at 7, I eat food. Do you realize this kind of person is having a problem? The person is binge eating, is eating too much all the time. And this could be the factor that's attributing to unhealthy weight gain. This person has come to you and has obesity, and this is their narration. So from their narration, you're able to identify areas that need changing. And then hence, you'll provide educational materials, information, and also support on how best this person can improve their diet. And after doing all that, you still have to offer follow-up to ensure that dietary changes are maintained. Okay. So what are the benefits of nutrition counseling? The benefits of nutrition counseling. Mr. Samuel, the next page, please. Yeah. So when we carry out nutrition counseling, one of our major goals is to make sure we develop a personalized approach, whereby these services are offered to individuals one-on-one. So the counselors provide tailored information based on an individual's current health status. Various individuals may approach a nutritionist. The ones who are here right now, majorly I'm seeing nutrition students. So you'll encounter patients of various cases. Someone may be having diabetes, another may be having hypertension, another might be having obesity. So each of these individuals, you handle them personally. This is what we mean by a personalized approach. So this is one of the benefits of nutrition counseling. And two, it also promotes health and well-being. It helps individuals improve their overall health by addressing specific dietary and lifestyle needs. And of course, on top of that, it also saves time, avoiding try and error with different diets and products by offering targeted guidance. So a person that approaches you with diabetes mellitus, you have to give them personalized advice and develop for them a meal plan that will help them overcome the problem of increased sugars in the body. And then we have also recommendations by nutrition counselors. What are some of the recommendations that we may have for nutrition counselors? One, we may have fitness programs. Usually when you go to a nutritionist and you narrate to them your issue, maybe you want to lose weight or you want to gain weight, there are some recommendations that these health practitioners and nutritionists will give you on how well you can improve your diet and improve your health and well-being. And one of these is the fitness programs, whereby there are customized exercise plans to support health goals. They could also suggest for you nutritional supplements that may complement your dietary needs. And you could also be given basic health needs, whereby you're counseled to ensure that you have basic nutrition requirements met. Who can benefit from nutrition counseling? Nutrition counseling is not specific to particular individuals. It covers a general population. Anyone of any age group can benefit from this program. People of all ages, from pregnant women. And when we target pregnant women, we are also targeting the child that will be born. We also target lactating women. We target the vegetarians, the elderly, even the youth, and also those individuals with medical complications. And the conditions that have mostly been targeted when it comes to nutrition counseling are diabetes mellitus, osteoporosis, hypertension, heart disease, obesity, and cancer. So these are some of the particular conditions that define the nutrition is always focused on when it comes to nutrition counseling. Eating disorders. This is also another part that is very, very important. Anorexia nervosa, I find that the person has phobia for gaining weight and they restrict their diet so that they consume very little. At the end of the day, what will happen? This person is going to become malnourished. From malnutrition, the person will lose appetite totally, will not even eat. And this condition can become very dangerous. It can even cause death. Bulimia, the person cannot control their eating. You find that they are gaining a lot of weight as a result of their eating habits. Binge eating, the person eats continuously. So all these are disorders that can be looked into when it comes to nutrition counseling. We also have other groups that may require fitness management. The menopausal women, then there are those particular groups of people with nutritional questions. Some people have allergies. Mr. Samuel, you have gone too far. We are still behind. Yes, we were still there. No, we go to the next. Good. So we also want to look at some nutrition counseling techniques. How do you offer this nutrition counseling? It is very important to have some of these techniques when you're carrying out nutrition counseling. Nutrition counseling has to be done in a professional manner. And there are some ethical principles that you'll be required to follow while you conduct nutrition counseling, as we shall see later on. So the counseling requires more than just giving advice. And as I said earlier, it aims for behavior change and desired nutrition outcomes using specific techniques. So we are going to look at some of these techniques that you may apply when conducting nutrition counseling. And one of the major approaches is the Galidra approach. Next. Yes, the Galidra approach. Each of these words represent a particular word that you're going to act upon to conduct your nutrition counseling. The G stands for greet. When a person approaches you, are you a health worker in the hospital or at the nutrition site or in the community, anywhere? The first thing you do, of course, is create a rapport. You build that relationship. You greet the person, create a welcoming atmosphere so that the person has no fear for you, so that this person can be able to open up to you. So that is one of the techniques. You greet and create a rapport. 2, you have to ask. Explore the patient's situation with open-ended questions. Do not be close-ended. Ask questions such as how, why, when, what, so that this person can be able to freely express themselves to you. And once you ask these questions and the person is expressing themselves, then you have to pay attention. Give a listening ear. Listen to both the verbal and non-verbal cues. When someone is narrating to you their scenario, usually, you can see how they feel. You'll observe the person, the body language. How are they talking? And how are they expressing themselves as they speak? These are aspects that you have to pay attention to. Then the I stands for identify. As the person is narrating to you their issue, you have to pinpoint the key problems and prioritize. Out of all the issues this person has told you, what is the major issue? You note it down. And then we come to the D. The D stands for discuss. Once you have picked the major points, you have to now discuss. Talk through the possible solutions using visual aids. For example, you're a nutritionist at a nutrition site, and a lactating woman comes to you. This woman is having a child of 2 months, and she's complaining that the child is not gaining weight, the child is not feeding well, and she feels like she's not having enough breast milk. So you listen to this person as they narrate to you. Why does she think she doesn't have enough milk? How does she know that this baby is not gaining weight? How does she know that this baby is not feeding well? All these issues, you listen, and then you jot down one of the important issues. For example, you could say, the most important issue I've gained here is that the mother is having low self-esteem. She feels like she does not have enough breast milk. Remember, some of the breastfeeding problems arise as a result of myths. Some mothers just have it in their mind that they may not have enough milk to support their baby's growth and weight gain. And yet, naturally, the body produces enough breast milk. We all know that scientifically. So after knowing that problem, you now talk through the possible solutions. Try to explain to them that it's not necessarily that you do not have enough breast milk. You have enough milk. Naturally, when a baby latches onto the breast, there's going to be the let-down process whereby breast milk is going to be released as a result of the action of prolactin hormone. So you explain to the patient or the client the possible solutions. Tell them to change their mindset, to be positive about the production of breast milk. They have to eat properly so that they can have more milk. They have also to learn how to position the baby well so that the baby can be able to feed enough during a particular breastfeeding session. So once you discuss all these options, you now recommend. You offer realistic, actionable suggestion. That is the R. And then the last 2 A's stand for agree. The client has to understand and commit to a particular action. Before you finish your counseling session, you have to make sure this client has understood what you have told them. And out of that, you do not coerce the patient to accept what you've told them. No, you only give options. Encourage the patient to have confidence in themselves. Encourage the patient to eat properly. Encourage the patient to avoid stress. So out of all this, the patient is going to choose and say, Thank you so much, doctor, for telling me all this, but I'm going to make sure when I go back home, I'm going to improve my diet. I'm going to eat well, and I'm going to make sure that I avoid stress by all possible means. So this is the patient agreeing to what you have told them. And of course, after agreeing, they will go home, try to change the behavior, try to do the right thing, and then you set an appointment. That is follow up. You say, maybe I expect you to come back to me after 2 weeks to assess how far you have gone, whether there is improvement or there is no improvement. So that is the Galidra approach of nutrition counseling. And this is what we've been talking about, establishing a rapport. This is where you build trust with the client. The patient comes in, you greet the patient warmly, offer a seat, introduce yourself, and let the person also introduce themselves. When you're establishing a rapport, you have to make sure you show interest in the patient by leaning forward, maintaining eye contact, and also by listening actively. And you have to make sure you also maintain professionalism throughout the session. Some of the things that may make us not to behave professionally during a counseling session is, for example, you have put your phone there. 5 minutes, your phone rings, this person is talking to you, pick up the call. Hello, sir. Yes, this and this. No. When you're handling a client, you have to make sure you put all these distractions aside. Put the phone aside, get a notebook, and jot down a few issues. And again, do not over-focus onto the writing. Listen. Maintain eye contact. Show interest in what the patient is telling you by leaning forward and listen attentively. So these are some of the things that will help you to behave professionally. And information gathering. This is where I talk about having a notebook. As the person is talking to you, you carry out some assessment from their speech. If possible, you do some anthropometry. Take some measurements. If the mother has come to you and you're visibly seeing that this mother is malnourished and indeed is having some stress, assess the patient or the client and look at the client, look at the clinical signs. What are some of the signs that show that this person is malnourished? The woman is looking very apathetic. The person is very thin, has lost a lot of weight, and is visibly looking stressed. So these are some of the things you view clinically and see from the patient. And then the behavior patterns. As they're expressing themselves to you, how are they behaving? Someone will even come and as they're talking to you, they're even tearing. So from that, you can judge that they're emotionally torn. They're not in a good state of mind. And also the environmental factors. For example, if you go into the community for a home visit, as the person is talking to you, observe the environment at home. How is the hygiene? How are the children conducting themselves? How is the father of the home behaving? All these are things you look at the environment in the home. And after there, you have to make sure also one of the other important thing is formulation of objectives as you conduct your counseling. The SMART objective, this is one of the major objectives. Your objective has to be specific. It has to be measurable. It has to be achievable, realistic, and time-bound. And the core objectives here, you have to make sure you carry out dietary planning in order to address the problem. For example, if the client lists for you some of the foods that they consume at home, select for the patient some appropriate portion sizes and plan a menu for the patient so that they are able to adhere to this new kind of diet plan. And you should have some additional objectives also. For example, preparing a shopping list, modifying the recipes, reading labels. Tell the client, when you go to the shop, don't buy anything anyhow. Look at the label. What is written? What are some of the foods you should avoid? For example, if it's a patient that is trying to lose some weight, you have to tell them to avoid high-calorie foods and focus on nutrient-dense foods. Information control. You have to avoid overwhelming clients with too much information. For example, as I gave you the example earlier of a lactating woman with a child of 2 months. She tells you her problems, and as you're trying to counsel her and tell her what to do, you start telling her about the physiology of the milk let down process. This mother is not going to understand what you're saying. Just tell her that your body is conditioned to produce enough breast milk as you feed your child. All you have to do is make sure you avoid stress. Be happy and try to have various options for feeding. Don't eat only one thing. Eat from this side. Eat some of these kind of foods. Yeah. Make sure you eat a variety of foods and make sure you're hydrated. Drink enough water. So all this you tell them in simple terms. Do not talk too much. Don't give too much scientific information that will overwhelm the client. And the strategy here is you have to move from simple to complex topics. Distinguish between need to know and nice to know information. The information that the patient needs to know is what you give. But there's some information that is just nice for the patient to know. This is not essential information. So there is no need for you to go into deep into the science of how milk is produced, of how malnutrition is caused. Just talk in literal ways. So information is one of the key motivators for a client to change. The client has to understand why you have given them a specific recommendation. Before you recommend something, you have to explain. And motivation is when a client comprehends the rationale and they are more likely to stay engaged and make changes. When you're motivated to do something and when you go back home, you find that you have the courage and you have much more interest in doing that particular thing that you have been told about. Then also we have what we call the learner performance. You have to make sure that you organize interactions to ensure clients can apply their skills at home. This is like a form of follow-up. When you have done your counseling, you have recommended the patient and they have gone home. After 2 weeks, they'll come back to you maybe for follow-up. Then you say, the next week, I'm going to come to your home. I want to come and visit you. So your purpose for visiting is to make sure you what? You assess the performance of this patient. How is this patient doing? Is it true that indeed they are changing or they're actually lying to me in front of me? So here you're going to practically observe and see what the client is doing in their home setting. Okay. And then as you do nutrition counseling, you have to make sure you do reinforcement and confidence building. Use positive reinforcement to build the client's confidence. Avoid negative criticism. Criticize the client positively so that they are able to make changes. And this kind of positive reinforcement will help the client practice the behavior independently instead of always relying on you. Doctor now this, doctor this, doctor this. Once you explain to them, they have understood and you reinforce and build their confidence, they are going to go home and they'll be able to apply these things independently without calling you every now and then. As you do counseling, it's also important to ask questions, to ask for clarity and also respond. And as you're asking questions, you have to make sure you use both open-ended and closed-ended questions appropriately. Encourage clarification and engagement with phrases like, when you are saying this and this, did I get you right? Is this exactly what you meant? For example, if you did not understand a certain aspect. Again, you could ask yourself, correct me if I'm wrong. Earlier on, you said this and this and this. Is it true? Then the client will be able to now explain to you more elaborately what they meant. So you make the session more engaging so that each of you are able to understand. Because we know that communication is two-way. The receiver and the sender all have to understand each other. And then, of course, listening. As I said earlier, you have to make sure you have active listening skills. One of the skills is to lean forward as the person is talking to you. Maintain eye contact with the client and respond with minimal encouragement. Like, for example, yes, okay, to show them that you're understanding what you're saying, nodding your head. And we have what we call the solar approach of listening. You sit squarely facing the client, maintaining eye contact. Make sure you're in an open space where there is no fear. And also you have to make sure you lean forward, make eye contact and relax. And you go beyond sympathy. You feel with the client. Imagine you're in the same situation with the client. How would you feel? So this is what we call empathy. Feel with the client. Reflect the client's strengths and challenges to show understanding and support. And then, of course, after that, you have to make sure you find solutions. And these solutions, you do not derive them by yourself. You have to discuss with the client. After telling you the problem, I'm having this challenge, my baby is not gaining weight appropriately, my baby is not latching well onto the breast, and I feel like there's not enough milk. Now you have to brainstorm with the client. You explain to them why they think whatever is happening to them is so, and then how can it be prevented or how can it be solved? And then from there, the client can be able to agree with you on a particular solution. And this solution should be feasible, acceptable, and realistic to the client's situation. Observation. Observe the physical cues, the body language, the environment, so that you're able to gain deeper insights into the client's condition. This I already talked about it earlier. Taking notes, recording the sessions. Make sure you take some minimal notes during the session to avoid distraction. And also don't overdo it, not that every time you have to be jotting down. No. Remember, as you jot down, you're also maintaining some eye contact with the client. And you're agreeing with the client. Yes, okay. You're nodding your head to show them that you're understanding what they are saying. Focus on listening and record key points afterwards. It's more important to record afterwards than record during the session. What are some of the best practices when you're conducting nutrition counseling? One, you have to avoid excessive note-taking during client dialogue. You have to focus on listening. Jot down only the key notes. You have to complete detailed notes afterwards and use the counselor's notes or the counselor's sheet or form. We have particular forms for particular counseling sessions. If it is a health education and counseling session, there will be a particular form. It is for nutrition, it will be a particular form. So there are some key points you have to note in this form. For example, if you're focusing on breastfeeding counseling, there is a form that shows you the breastfeeding problems for the mother and for the child. So as they are explaining to you these things, you tick, you cross, you tick, you cross. Make sure you just pick out the important issues that are being noted. And after the counseling session, you have to terminate the session and summarize. Summarize the key points before ending the session. And during this session, that is where you go on and do empathy and asking of questions. You know, you ask yourself, for example, if you did not understand a certain aspect the client was trying to tell you, you ask, earlier on you said this and this and this. Is this what you meant or something else? Then now the client will open more and explain to you what they were trying to mean. And then check for client understanding, provide positive feedback. Make sure the client is understanding. And if they have not understood, explain more. And then you have to provide positive feedback to the client. Make sure you leave the client feeling valued and motivated to return. Ensure the client feels valued and understood. When the client understands what you're saying and you create this friendly environment, there is a way when they go back home, they will eventually come back. But if the client feels like, this person enters the room and feels the energy around is so negative, you're so gloomy, you're not even focused, the person sits down, you don't even greet, and after there, shortly your phone rings, you pick, this client is going to be discouraged from the very beginning. And likely this client will not come back to you for counseling. So you have to make sure you create this friendly environment. Make sure the client feels valued and understood. Follow up. This is the final step. You have to follow up. Following up, it helps you to make sure you assess the progress of this client, address any new issues, and provide further education. You could also assign new tasks and arrange the next appointment if there is need. You could update your notes based on the client progress. For example, if this mother comes back, she tells you, doctor, When I went back, I made sure that I improved my diet. My husband used to stress me too much, but when I went back, I made sure that I do not focus on whatever he says. I'm focusing only on myself and my children. I no longer care about what he says. And this has helped me to avoid stress. So you also update your notes according to how the client is progressing. And during these follow-up sessions, you can also identify and address any new complications. The client would tell you, I've noticed there is a change. At least now my baby is feeding well. I have learned how to position my baby very well here, like this and this. But then again, there is this thing that I feel like is still lacking. So you identify and address any new complications. Then you review the previous assignments and dive deeper into the current issue. And on top of that, you could also provide additional assignments and resources. So that is the major part of nutrition counseling. Those are the major steps. And then we also have what we call motivational interviewing. This is a collaborative, goal-oriented counseling approach that is designed to help individuals find the motivation to make positive behavior changes. So as you can hear, motivational interviewing, make sure that as you're carrying out the counseling and you're interviewing the client, you help the client find the motivation. You make them feel in high spirits, make them feel valued, make them feel understood so that they can be able to continue engaging themselves with you. So this one will focus on strengthening a person's internal motivation by resolving ambivalence, by guiding rather than directing the conversation, and also respecting the individual's autonomy. What are some of the roles of practitioners in motivational interviewing? Motivational interviewing particularly helps clients through behavior change using particular components. And one of these components is partnership. There should be collaboration between the client and the health or nutrition practitioner. Acceptance and empathy. When you respect the client's autonomy and feelings, the client is going to be more motivated. And then affirmation and evocation. You reinforce the strengths and help the client find their own motivation from within themselves. All right. So we have 4 major motivation interviewing processes. 1 is engaging. During engagement, make sure you build rapport. 2, you focus by setting clear goals, and then also you evoke by drawing out motivations and addressing ambivalence. Then you have to also plan. During planning, you make sure you focus on the goal setting and address any barriers to achievement of these particular goals. And then we have the technique called the OARS technique in motivational interviewing. This is whereby you find that as you're carrying out your interview, you ask open-ended questions. O stands for open-ended questions. You make sure you ask questions that are open-ended. For example, the mother is telling you, I feel so stressed. I cannot even eat well. I cannot even have good appetite, Instead of asking, is it because your husband is stressing you or not? Or is it because, instead of asking a question that requires a yes or a no, you're going to ask, Mama, why do you think? Why is it happening so? So this mother is going to open up and tell you a vast reasons as to why she's feeling stressed. So from here, then you're going to be able to pick out the major issues that you can note down, and you can help the client to improve. Then affirmation, you have to make sure you build confidence and acknowledge efforts of the client. Encourage the mother and tell her, Mama, thank you so much. It's all these challenges, you have tried to take care of your baby, and this is the most important thing. Make sure you continue taking care of your child very well like this. And tomorrow your child is going to become better and improve. Make sure you also take yourself better. Take care of yourself better. So when you encourage the client and build their confidence, then they are going to become motivated. Reflections. Show understanding and encourage deeper thinking. And then summaries. You can also provide a recap to ensure understanding and reinforce progress. So that is the OARS technique of motivational interviewing. The importance of affirmation and reflection. When you affirm a client's strengths, it helps to boost their confidence and motivation. And also reflective listening ensures the client feels understood. It creates trust and encourages changes in the clients. How will you manage time constraints in sessions? Make sure you do not have abnormally long sessions. The sessions should be short in order to prioritize key aspects of motivational interviewing. And these strategies could include focusing on the key issues, obtaining client permission before sharing information, and goal setting. And then resistance can also extend the MI process over multiple sessions. You find that you cancel the mother today, she does not, she feels like things are not working. The next time they come, you realize instead of improving, the client is declining. You have to make sure you continuously cancel this client. And because of this kind of resistance, you find that you may have to have more sessions so that this patient can change than when you had a few sessions and the client improved without resistance. Addressing misinformation. There are a lot of health and nutrition myths in the community. So you make sure as a health and nutrition practitioner, you must clarify any health myths and misinformation. For example, a mother saying that I do not have enough milk for my baby is a myth, because naturally the body produces enough. Whether you have big breasts, whether you have small breasts, your body is going to produce enough milk for your infant. Another mother could say, in our community, we do not give the baby the first milk. It is said to be bad. This is a myth. We know that colostrum is very important. It contains the major antibodies to strengthen the baby's immunity in the first few days of life. So you have to make sure you provide concise, accurate information that helps the client to make informed decisions. All right. Integrating the client's life in counseling. You make sure that these recommendations are tailored to the client's lifestyle and experiences. Address any kind of disordered eating, body image issues, and physical barriers to physical activity to enhance motivation. When a client comes to you and is having the issue with self-confidence, they have this excessive fear for gaining fasting, is not eating well. From there, you can judge that this person is suffering from anorexia nervosa. So you have to address these clients and tell her, it is normal to gain weight. It is not necessarily that people who are very thin are the healthy people. No, you have to tell them all the sides so that they understand the issue broadly and they're able to improve their habits. Client engagement and continuity. As you engage the client, there are some action steps that you could take to make sure that these sessions continue without disruptions. You have to schedule the next appointment as needed. If you're having appointments per fortnight, after every 2 weeks, you've met the client today, next Friday, and then the other Friday again. You schedule another session according to your calendar. Update the counselor's notes for continuity. Whenever the client comes back and you have another session, you have to update your notes. Where are the areas where there is improvement? How about those areas where there is no improvement? What about the areas where there is relapse? Still, you have to update and see what to do next. And you have to maintain ongoing support and encouragement. You can encourage the clients by approving what they have done well and by encouraging them to continue doing it better and to also stop doing certain things. You can also go ahead and take an extra effort of going to their homes for a home visit. You can pick your phone and call and ask how they are progressing. So when you do that, you find that they'll feel more confidence and they feel valued. So we have some qualities of a nutrition counselor. To be a good counselor, you have to make sure you are empathetic. Empathy, you have to feel with the client. As they're telling you the situation, imagine you are in their situation. That is what we call empathy. You also have to sympathize with the client, be sympathetic, you know, show them that you're not feeling good about their situation also. And you have to make sure you build rapport and trust with the client. Competence in counseling. To become very competent, to make sure that you are carrying out quality nutrition counseling, you have to have knowledge of the latest trends and issues in nutrition and dietetics. For example, if you're handling diabetic clients, what are the current trends in diabetes? What are the current latest approaches in trying to beat diabetes? You have to make sure you have knowledge, you have read and understood how to overcome various challenges before you go into a counseling session. And you have to make sure you translate this scientific knowledge into practical application. Do not start narrating to the client the science behind diabetes mellitus, you know, but instead tell them, you know, you are having this condition because you're not eating the right foods. You're consuming too much sugars and your body is gaining weight rapidly to an extent that the organs cannot be able to compete with the amount of nutrients you're taking in. So you make sure you translate this knowledge into something that you can apply to daily life. Balance the art and the science of nutrition counseling. Balance your knowledge and balance with your techniques of counseling. What are some of the nutrition resources for nutrition counselors? We have official agencies that utilize information from government bodies. For example, the Ministry of Health, the Ministry of Education. You know, for example, we have the MIYCN guidelines. Then we have the CMAM guidelines. All these guidelines have information on how best we can be able to improve and carry out nutrition counseling. You have to also make sure that you get information from ministries focused on public health and nutrition. These are official agencies through which you can get information to carry out nutrition counseling. Academic resources. Engage with different universities and counseling institutions for current research and training. Global support. There is a lot of data online, and globally, there are some agencies that carry out nutrition programs. So they have different guidelines and recommendations, like the World Health Organization, UNICEF, UNHR, Food and Nutrition Technical Assistance, World Food Program. All these agencies have vast of information concerning nutrition. So you have to make sure you're updated every day before you carry out any counseling session. Internet exploration. The internet has a lot of information, online databases and websites that have up-to-date information on nutrition. And then you could also gather information from non-professionals who may offer valuable perspectives. Okay, so we also have the ethical principles for counseling. Before you carry out any counseling session, there are some ethics and standards that you should follow so that you can have a fruitful, professional counseling session. For example, accuracy. You have to make sure you provide truthful and reliable information. As I've stressed this already earlier, make sure you get information from credible sources. And before you go into any session, have knowledge about the condition you're going to handle. Confidentiality. Assure the client that you're going to keep their information private, and also the environment around which you're carrying out your counseling has to be in such a way that there are no distractions and people listening to whatever is being done. That's why even in health facilities and even nutrition sites, there is a counseling corner. That corner is only accessible to client and the nutrition practitioner. So it's confidentiality. And then also autonomy. Respect the client's rights to make their own decisions. Next. You have to make sure that your session is client-centered. You act in client's best interest and suggest alternatives. You have to make sure you follow the do no harm principle. Avoid interventions that might emotionally, financially, or medically harm the clients. And fairness. Treat all clients equally, respecting their rights and their dignity. So these are some of the ethical principles for nutrition counseling. Yes, Mr. Samuel, next. We also have some tips for effective counseling. And this, you've already mentioned them severally. You have to listen, you have to make sure you ask open-ended questions, and you have to be empathetic, show genuine interest, and avoid judging the client. You have to make sure that you are very practical, offer suggestions that are possible in the client's context. Take small steps, provide small digestible pieces of information at a time. And you have to make sure you speak a clear language, simple and easily understood language to the client. Don't be very complex. Do not start mentioning scientific terms to the client who barely understands any of these concepts. So let's go to nutrition care plan. A nutrition care plan makes sure that there is collaboration with the client to set achievable goals and create a care plan. In this plan, you have to make sure you engage various health practitioners. Your plan may not be only centered on the nutritionist. It has to be integrated with other sectors. For example, the issue of diabetes. You as a nutritionist, you're going to provide the nutritional knowledge on how best they can feed and exercise to curb the condition. But again, there is a medical personnel that is going to tell the client which medicines to take in order to keep the condition in control. And as you recommend the exercise, there is a sports nutritionist that is going to carry out these exercises to make sure that the client also improves. So the plan is not centered only on one side. It has to be all round. And as you follow up, you have to make sure you regularly review your client's progress and adjust the plan as needed. So what are the role of healthcare professionals in nutrition? In nutrition counseling, you find that nutritionists and dietitians are the core professionals. But again, as I've said, we work together with the nurses, with the community health workers, and also with the volunteers and home health promoters. There are a vast number of practitioners that work together to make sure that this kind of counseling and education is carried out effectively. What is the role of the nurse? It is to recognize the different issues, the health issues that are prevailing in the clients, and also the nutrition issues by carrying out nutrition screening. And then the nurse can also provide an opportunity to influence positive behavior change in the client. And like I've said, there should be teamwork. There should be collaborative approach to improving the patient outcomes. Work together. Do not isolate yourself from other healthcare professionals. And then there are some challenges that we may face in nutrition as we carry out this counseling. One is the patient burden. This is a major practical issue that we are facing, especially in our context in South Sudan. As we carry out these various nutrition programs, we find that the client load is too high, and the practitioners, they are few. You find that the practitioner to client ratio is about 1 to 10. One person has to handle over 10 clients in a day. So because of that time constraint, there is going to be a high dropout rate of these clients. You may not be able to give full attention to all of these clients every day. The use of resources also is another challenge. And these resources may not be available. When you go, for example, into the different communities, we have in few facilities, the primary healthcare centers, the primary healthcare units, they're not adequate enough to cover the whole population of a country. So because of the lack of these kind of spaces or facilities, you find that our nutrition services are limited. So those are some of the major challenges that we face in nutrition counseling and in offering of nutrition services. Evolving role of technology in nutrition. Technology has become vastly very important in carrying out nutrition activities and sensitizations. And we have a lot of resources and fitness programs and even applications that help clients to adhere to proper eating choices. So the technology is very important and it has helped to increase access for a wider audience. For example, as I talk to you right now, this session is recorded and it's going to be uploaded on YouTube, and a lot of people are going to be able to access it and get this knowledge of how to conduct nutrition counseling. And it also helps efficient use of healthcare resources. With e-counseling services, we can be able to reach a lot of people in a short time. And with this kind of evolving technology, we have to make sure that we ask ourselves the question of how this technology and expanding health professionals can improve intervention outcomes. Yes, so to carry out effective nutrition counseling, you have to make sure that there is patient privacy and comfort, and you have to provide proper training for the counselors. You, as a nutrition worker, you're going to go ahead and work in a community of people that don't have these skills, and you'll be the one to train the other community workers, such as the volunteers, on how they can conduct nutrition counseling. And you make sure you use appropriate materials, illustrations, food models. All those are some of the resources that you can use as you conduct nutrition counseling. And as I've already mentioned about this, ethical values in nutrition counseling, make sure you provide accurate information, build confidentiality, respect autonomy, do no harm, and also be fair in your judgment. Offer equal attention and respect for all patients' rights and dignity. Hello?
Yes, please, you're not seeing?
Yes, ma'am.
Okay, yeah. So let's look at the patient-centered approach in nutrition counseling. In patient-centered approach, you have to make sure you focus, combine all the different aspects of the human system, the psychological, the physiological needs, and the patient preferences. And we have what we call the Rigorian model. Here we have to identify, the patient has to identify the diet-related problems, and the counselor has to provide the solutions. You have to make sure the patient acknowledges the problem they have before you offer any solution. And our roles as dietitians and nutritionists is to translate scientific knowledge into actionable steps based on individual needs. And this is going to help us to offer effective patient-counselor relationships that will lead to better outcomes and also adherence. There are some challenges that we face usually during nutrition counseling, and this is one of them is having multiple information sources. You know, there's a lot of information on the internet on various issues to do with nutrition. So as a nutrition counselor, you have to make sure you pick the most credible source. Pick a source that is recognized worldwide by the respective agencies. And then adherence. There is a high dropout compliance. These are some of the things that may hinder success. You'll counsel a patient today and expect them to come back in 2 weeks' time. The 2 weeks pass, no one appears. 1 month, no one has appeared. 2 months, the person is not coming back. Of dropout also hinders the effectiveness of the nutrition counseling. And then, of course, we also have technological issues. These issues can be solved by having e-counseling that reach more patients and improve the follow-up rates. So in the clinical settings and evidence-based interventions, you have to make sure that you use the right guidelines. Guidelines are very important as you offer nutrition counseling. The nutrition counseling must follow the established guidelines, especially in the clinical settings. If you are carrying out community nutrition activities, make sure you have the CMAM guidelines next to you. Make sure you have the MIYCN guidelines for issues to do with pregnant and lactating women and children under 5. Have all these guidelines next to you so that you understand and have knowledge of what you are talking about. For example, if you are talking about cancer, nutrition is a complementary treatment that can be approached carefully to avoid cancer. So how are you going to apply this nutrition knowledge so that you help the patient to have better choices to prevent cancer or to treat cancer? Our role as professionals is to make sure that we offer accurate and scientific-based advice to the clients so that they understand and adhere to these various recommendations. Next. Yes. So enhancing adherence to nutritional interventions. How are we going to make sure that there is adherence to these particular interventions, that the rate of dropout is not high? One, what are some of the factors for success? Consultation duration and frequency. How often do you engage this client to come back for review? Are you offering clear and measurable goals for each session? Ask yourself that question. Are you giving regular feedback to the clients? So if you're able to do all this, then you are going to be able to create adherence to the different interventions. Structured interventions. These are more focused and well-defined objectives that will make sure to improve the outcomes. All right. So like I said earlier, when you're carrying out nutrition counseling, you don't do it as an individual or as a nutrition professional alone. It is a collaborative effort between nurses and nutritional practitioners. Nurses and dietitians are the key to improving patient nutritional outcomes. The nurses are going to reinforce and facilitate nutritional plans and interventions that are designed by the dietitians. And a lot of studies have shown that this collaboration between nurses and dietitians improves patient compliance and nutritional outcomes. All right. Then we also have what we call the ward-based nurses. These are nurses that are stationed at the different wards in the hospitals. These nurses, their role is to carry out nutrition screening, nutrition education, and also promote patient compliance. They will carry out and identify patients that are at risk for malnutrition. Once they identify these clients, they bring them to you as a nutritionist. Then you start carrying out your work. As you counsel these clients, the nurse is also reinforcing the dietary education that is provided by you, the nutritionist. And at the end of that day, they are also going to help you to ensure that the patient's nutritional interventions. The challenges we have right now is the lack of time and assistance during mealtime. There are not enough health practitioners to help these clients to adjust to different recommendations that are provided. And there is lower prioritization of nutrition counseling compared to other duties. Nutrition is one important aspect that is being very ignored in most of our settings. You find there is not enough collaboration between doctors and nutritionists, between nurses and nutritionists. And this is going to lower the adherence rate. We already talked about e-counseling, the role of technology in nutrition counseling. This e-counseling provides remote nutrition counseling via e-health, digital health, and then mobile health technologies. This ones will help to reduce the barriers like time constraints and geographic distances. And the best example here is the role of internet, the different social media platforms, WhatsApp, Facebook, TikTok, Twitter, Instagram, all these platforms. Once you post your health information and nutrition information, there are a lot of people are going to receive this information and they'll benefit from it. So e-health has become very important in a way that it improves the patient engagement, especially with smartphone apps. And we have also AI-based apps that provide real-time dietary assessments and improve nutritional outcomes for chronic diseases. The e-counseling shows promise in achieving clinically significant weight loss and reducing costs in the long run. Instead of someone having to go every day or every week to Al Sabah Children's Hospital to get counseling on how best they can breastfeed their child, a person can be able to receive this information live online. You sit in your home and browse and listen to the tips and advice on how best to breastfeed your child or how best to feed in order to lose weight. So e-sources have become very important in improving our health and nutrition well-being. Next. There are some challenges of e-counseling. For example, it is difficult to establish empathetic relationships through e-counseling. Most times, you just find this information has already been posted. You're not being live with the doctor. So in that case, you're just listening in and picking the points that you need, but you are not engaging with the practitioner physically so that they can be able to feel your situation and give you individual-centered information. And there's also more research that is needed to assess the long-term efficacy of these applications in clinical settings. Yes, that is the theoretical basis of nutrition counseling. Those are the major aspects that we have to look at. And I hope each of you who has been in this session has been able to understand. And let's see if we have some questions that you're asking. Maybe you give chance to one or two people to ask a few questions, then we can close off the session.